We do two types of operations at our hospital. The first type is what we call plastic reconstructive surgeries, including non-improving injuries, innate anomalies, some deformities on the body, and all kind of reconstructive surgeries. The second type is aesthetic surgeries. If we are to give some examples, around the head and neck area, like cleft plate, cleft lips, the hemangiomes and arteriovenous malformations, finger defects, congenital anomalies. Nearly all of them can be treated at our clinic. Aesthetic surgeries, on the other hand, are the ones mostly performed. Eyelid surgeries, for example, both upper and lower lids, facelifts, rhinoplasty, nasal surgeries, as we call them, lips, neck lifting, mammoplasty, including breast reduction, breast augmentation, silicone implants, mastopexy, lifting, liposuction, thigh lifting, vaginal tightening. All the aesthetic operations can be done here. Thanks to the state-of-art technology and equipment, now the hospitalization time is much more shorter in all aesthetic operations. Even for the most complicated surgery, we can say that the hospital stay is around 2, maximum 3 days. For simple operations like rhinoplasty or breast surgeries, it is 1 day only. Apart from that, for big operations, we ask our patients to stay in Istanbul for a week. For minor surgeries, though, 2-3 days of stay in the country is enough. For pediatric patients, we do the cleft lip surgeries around 3 months old and cleft palate surgeries like 9-12 months old. For the vessel malformations, which we call hemangiomas, we prefer to do the surgery at the age of 3-4, unless the location of the anomalies makes it necessary to act earlier. The breast implants are being used for the patients who do not have breasts. Those who did not have their breasts developed in puberty in order to form a natural look breast. Apart from that, also the cancer patients who had their breasts removed, these implants can be applied. We decide on the shape and the size of the implant according to the patient. We have drop-shaped implants, the anatomic ones, and the round circular implants. The choice depends on the anatomic characteristics of the patient. For instance, if the patient is petite, slender body type, and she has some amount of breast tissue, then we prefer the half-sphere implant types. For patients with no breast tissue, then we prefer the drop-shaped ones mostly. We can place an implant in 3 ways. We can make an incision from the nipple, we can enter from the under breast, or from underarm. Where is the location for placement? Well, it can be placed right below the breast gland or under the muscle. Well, this is again determined by the tissue thickness. There may be early or late stage complications. During the early stage, right after the operation, some complications due to anesthesia or due to the operation itself may occur. The operational ones can be bleeding or problems like an infection following the surgery, or blood buildup may be seen. Following the operation, it is expected to see a mild bruise or swelling on the breast. If these signs are extremely strong, then they may also be addressed as complications. And at the later stages, the relocation of the implant may happen. Again, at later stages, it is possible to encounter a situation which we call a capsule reaction. This is a reaction that the body develops against the implant. At the end of the day, the implant is a foreign object for the body. These last two depend completely on the patients. So, what are the precautions for early stage complications? We make the patient use antibiotics. We also make a profound examination prior to the operation and place a drain. They are left there for a day, and with the help of them, we evacuate the unwanted blood not to leak inside. The novel implants we use do not cause any cancer. It is out of question if the silicone harms the breast tissue in any way or has any other negative effect on human health. We perform breast augmentation surgeries after the age of 18 generally, because the body completes the biological development around that age. The breast implants do not have any negative effect on breastfeeding. The patient can get pregnant and breastfeed afterwards safely. The implants that we use right now are the ones with a lifelong guarantee.